Good afternoon, everybody. Thanks for joining us today for our Illuminating series. My name's Holly, and I am the Community Engagement Coordinator here at Lumina. If you have friends or colleagues that weren't able to join us today, this is being recorded, so it'll be available afterwards on our website. And if you have any questions, feel free to use the chat box today. We'll address them as they come up. And for those who have not joined us before, this is part of our Illuminating series here at Lumina, and it's a monthly webinar that we do various topics on aging, grief, support services, end of life. And today we're hearing about how to support veterans and their needs. And so I will introduce our guest speaker today, Lacey Carter. She's an aging veteran outreach specialist with the Oregon Department of Veterans Affairs. Lacey earned her bachelor's degree in corrections from Western Oregon University before enlisting in the U.S. Army as a military police officer. She served with the 527th Military Police Company from 2002 to 2005 in Germany, as well as in Iraq in support of Operation Iraqi Freedom 1. Her professional career includes 10 years as a deputy sheriff and sergeant with the Marion County Sheriff's Office Parole and Probation Division. She returned to the Oregon Department of Veterans Affairs as the aging veteran outreach specialist in order to serve the state's most vulnerable veteran population. She currently works as a USDVA accredited representative, providing benefit claims, representation, and support for veterans and their families served in the ODVA fiduciary programs and residing in the Oregon Veterans Homes. Her role also includes passionate outreach, education, and advocacy on behalf of aging veterans and their families throughout the state. Okay, bring Lacey in here. And I'm going to go away. Okay, all right, I'll turn it over to you.
Excellent. Thank you so much, Holly. I really appreciate it. And thank you everyone for having me and being here today. Let me share my screen. All right. There. All right. Excellent. So I won't bore you with the details. Holly was kind enough to share an introduction, so thank you so much. As Holly mentioned, I'm very informal, so if something comes to mind and you have a question, please don't hesitate to put it in the chat. I know sometimes it's hard to try to remember everything until the end. So today we're going to be talking about just some things to know when working with veterans. And in knowing more about veterans, military service, and military culture, you can really provide improved care and connection to veterans and their families, and ultimately improved outcomes and relationships, whether it's with clients or even with coworkers or other people that you encounter throughout your life. Although veterans may be entitled to receive VA healthcare and other services through the United States Department of Veterans Affairs or VA or federal VA, many veterans still choose care in community-based settings. Consequently, clinicians, providers, and caseworkers working in any healthcare setting are likely to encounter veterans and their family members, and may benefit from increasing their military cultural competency so that they can better respond to the veteran population. As a veteran's military service may impact or be the cause of chronic health conditions and or physical and mental health disabilities. And when I say, I'm going to say ODVA a lot, and I'm referring to obviously Oregon Department of Veterans Affairs, but one of the things that I think is important to mention is that the Oregon Department of Veterans Affairs is a separate and distinct agency. It's a state agency in the state of Oregon, obviously, different than the federal VA or USDVA or just VA, commonly known by veterans and others. So ODVA is the state agency that I work out, different than the VA. ODVA became a state agency in 1945 when Oregonians committed to serve veterans returning from World War II by creating a state agency that would focus on their needs. 77 years later, the ODVA continues that mission to serve and honor veterans through our leadership, advocacy, and strong partnerships. In order to deliver on an incredibly broad mission, we focus not only on creating new programs, but rather aligning and partnering around a shared vision and coordination of existing resources. ODVA unites government, private companies, nonprofits, and other veteran service organizations to address issues facing veterans and their families. We are building support around specific issues that affect veterans, and we maintain strong relationships with key partners that allow us to continue to be a leading voice and advocate for veterans. Military service shapes every generation of veteran, from the era they served to the pronoun they prefer. All veterans have experienced adversity. ODVA works in partnership with local and federal government and nonprofit partners to deliver resources, services, and benefits that meet the need of the current day veteran. And as I mentioned, we provide advocacy and special advocacy in the form of specialized coordinator positions who have expertise for several specific veteran populations, including women veterans, houseless veterans, LGBTQ+ veterans, incarcerated veterans, and aging veterans. As the aging veteran outreach specialist, I provide claims assistance and advocacy focused on the needs of aging veterans. The Oregon Department of Veterans Affairs Aging Veteran Services Division provides oversight of the 2 Oregon Veterans Homes, the conservatorship and representative payee programs, and also specialized volunteer and outreach advocates through our veteran volunteer program. Oregon has a veteran population of nearly 300,000. Of those Oregon veterans, almost 37% served in the Vietnam era, making it the largest portion of the veteran population in Oregon. In Oregon, over 13% of veterans are Black, Indigenous, and people of color. Almost 10% are women, and over 50% are 65 years of age or older. Too few Oregon veterans are accessing their earned VA benefits. And although not all veterans are eligible for all benefits, there are many more who are likely eligible for benefits and are simply not receiving them because they never applied or were ineligible or denied in the past and have not reapplied. And I'll talk more about why this is important. But VA benefits laws and eligibility criteria have and are continuing to change frequently. And so there are veterans who may be entitled to benefits now who don't know that there have been changes in the law that would change their eligibility, or who are just frustrated that they were denied in the past or with the system in general and aren't seeking those benefits. So one of the missions of the Oregon Department of Veterans Affairs is really to connect with veterans. My mission specifically is aging veterans, to ensure that they are accessing benefits that they've earned. The relevance of training like this for care staff is that the likelihood of providers or care staff or case managers having interaction with veterans or caring for veterans is high, specifically Vietnam era veterans, as that is the largest portion of the veteran population in Oregon today. By better identifying patients or consumers who have had military experience, you can improve patient safety and satisfaction. Understanding military and veteran culture can help veteran patients engage with providers and help providers better manage the need of veteran clients. Knowing exposure types and health risks specific to veterans can be beneficial in identifying potential problems that may have not yet been addressed, and encouraging veterans to connect with VA disability benefits that are associated with those exposures and hazards. Long-term care needs of veterans is a long-term issue. Older veterans and their families will need access to long-term care, home and community-based services, prosthetics, physical and mental health care, expanded medical transportation, and pharmaceuticals over the next 40 years. Just briefly, I wanted to give a little bit of information about what a defined veteran is technically for benefits purposes. So for the purposes of most VA benefits and services, a veteran is anyone who served on active military duty and who was discharged or released under conditions other than dishonorable. Under certain circumstances, dependents or survivors of a veteran may also qualify for benefits. The federal VA's definition of veteran requires not only that the person had military service, but also that that service was active. And in general, active military service means full-time service other than active duty for training as a member of the Army, Navy, Air Force, Marine Corps, or Coast Guard, or Space Force now, or as a commissioned officer of the Public Health Service, Environmental Science Services Administration, or National Oceanic and Atmospheric Administration. Under the law, active duty does not normally include attendance at a school under military orders or military training as a reserve officer or member of the reserves or a National Guard unit. However, members of a reserve or National Guard unit that are called to active duty under presidential orders may be eligible for veterans benefits. Additionally, there's circumstances of service and whether they qualify as active military service that are laid out in law that can make it difficult to determine if you have met the active service requirement or are in fact eligible for benefits based on other factors. Some factors impacting eligibility for benefits include the length or type of service, whether you were injured or have a disability because of service, have a service-connected disability rating, age, income, discharge status, etc. It's important to mention that discriminatory practices and policies that included things like don't ask, don't tell, negatively impacted and injured thousands of LGBTQ plus service members or veterans, resulting in the loss of earned benefits. Changes in the law and through discharge upgrades or VA consideration, some veterans who have dishonorable discharges may still be able to obtain benefits. Also, there are veterans, especially Vietnam veterans, who are suffering from undiagnosed mental health conditions or traumatic brain injuries, who were subsequently discharged under other than honorable characterizations because of what were considered behavior or conduct issues, or even substance abuse rather than being treated for their physical and mental health needs. Those people may also now be eligible for benefits and should seek assistance in obtaining them. So I guess the one takeaway I'd say is if there's any question about whether someone is a veteran or whether they believe they're a veteran or not, there are county veteran service officers available in every county in Oregon and many tribal areas in Oregon that can help sort it out. That service is free, they're easily accessible. And so that would be the local expert resource in your area that you can point someone to if they have questions. As I mentioned, health providers are likely to encounter veterans, and veterans have healthcare needs and deal with issues that are unique to those who've served. So according to the Oregon Veterans Behavioral Health Study that was conducted in partnership by the ODVA and the Oregon Health Authority in 2018, about 2 out of 3 Oregon veterans receive physical and behavioral health care through the private sector. 9% of Oregon veterans are on the Oregon Health Plan. Not all veterans are connected to the federal VA, and not all honorably discharged veterans are eligible for VA healthcare or other VA benefits besides burial and home loan guarantees. And I think that's important to note. There, a lot of times I'll get calls and people will say, well, this person was honorably discharged, so they have to be getting VA healthcare. And unfortunately, that's not the case. Not everyone will be able to access that benefit. So just something to keep in mind. Part of determining if someone is a military veteran is obviously if it's documented in their medical record. I will talk a little bit about just my experience. I have my own healthcare providers through my work, my health insurance through work, but I also have access to VA healthcare, and I use both. It's rare that I've had private providers ask whether I'm a veteran. And I think it's a missed opportunity in a lot of different areas, not just healthcare, but just different services and programs that are being offered. Because one, it starts a dialogue, obviously, that wouldn't happen if you weren't asking the question about service. But two, that service, as we'll talk more about, can really impact someone's mental and physical health for the rest of their lives. And so I think if we can spread the word about asking about service and what that service looked like, the benefits are substantial for veterans and their families. Obviously, if it's not documented in the medical record, and most likely it won't be unless the veteran volunteered the information, then you can ask about service, add it to intake forms or different things that you're doing when you're first meeting someone. Listen and look for clues that your patient may be a veteran. I know it's kind of obvious and silly, but it's amazing how many veterans, especially aging veterans, will wear the ball caps that say that they're a veteran, or they'll have different things on that are going to kind of clue you into that could prompt you to ask. A lot of veterans in my generation, they aren't necessarily wearing the stuff that specifically says they're a veteran, but they may be wearing things like, Grunt style, that's a brand, 9-line apparel, different things that might be an indicator. Veterans may address you as sir or ma'am, even if you're younger than they are. The presence of tattoos or other memorabilia may give away that they're a veteran. So tattoos are not even pretty. They are very common for enlisted veterans. So another great way to initiate conversation. According to Convoy and Westfall, the first step in assessing if a patient or consumer is a veteran is simply to ask. And when you ask, we're really trying to encourage people to ask, have you had military experience, or did you serve in the military? We're trying to get away from asking if someone is a veteran, simply because there are a lot of people who've had service that has caused them to question whether they're a veteran. So especially with aging veterans that are women, they may have served honorably, have the discharge documents and everything, and then because they're women or they didn't necessarily serve in combat, a lot of times they won't consider themselves a veteran. Like we mentioned previously, so those who were discharged dishonorably because of mental health issues or traumatic brain injuries or their sexual orientation may have had dishonorable discharges that could be upgraded. And so those individuals may not consider themselves veterans either. So just asking if you served in the military is important. And then obviously, digging into that a little bit, and I'll provide some questions that'll kind of help explore what that military service looks like. But I think it's important, and it really can't be overstated, that asking about military service and knowing about someone's veteran status really is a safety issue for veterans. There are real health risks for veterans that if they're not assessed and they're not included in a treatment plan, may result in long-term consequences for not being addressed, and based on their exposures and other things that happen in service that are different than civilian counterparts. And the part of that, like I mentioned, when you're asking about service, is asking about what they did in the military, whether they had deployments, whether they served in combat. Some of those things I know seem kind of basic, but you'd be surprised how few people ask those questions and miss out on those opportunities. The U.S. Department of Veterans Affairs actually has compiled and posted, and they have it on their website, a military health history pocket card for clinicians that has an assessment questions that they recommend for people to ask to enhance veteran-centered care. Strategies for working with veterans obviously include learning about their service, acknowledging their military experience, evaluating their functional status, increasing their own health literacy, and then complementing VA care services, and most importantly, encouraging them to connect to the VA or veteran service organizations. Another amazing free resource that I want to mention is the Psych Armor Institute. So they provide videos and other resources to enhance military cultural awareness. They have a provider course called 15 Things Veterans Want Healthcare Providers to Know. They have another course called Connecting with the VA and Veteran 101 Military Culture. They're super short, they're interesting, they're engaging, they're fun to watch. They're not a boring video by any means. And they have other veteran specific topics that can enhance that relationship that you build. In addition, they also want to recognize those who make the effort to increase their military cultural competency. And so they offer a veteran ready healthcare provider certificate that may be something that you're interested in. So just a few questions here. I'm not going to read them to you out loud, but just some things to keep in mind to kind of explore that relationship and military service with a veteran. And I'll send these, Holly, if you want the slides also. I forgot to mention that earlier. So I'm not going to go into all of the details of military or veteran culture. Obviously I'll mention a few things, but there are a lot of really great training out there and available to you if it's something that you're interested in learning more about. The big takeaways obviously are that military or veteran culture really shapes someone's life. I mean, period. Whatever that service looks like, it impacts someone's life. Now, the extent of that impact obviously depends on the veteran and the experience that they had in the military, but it's substantial for a lot of people. And then it transcends all ethnic, socioeconomic, and educational backgrounds. So there's something about being a veteran that connects you to other veterans regardless of anything else about them. And it can be, I was trying to think about this a little bit today before I was going to give this presentation, and I was thinking about, I went to a food truck place like the Yard or something, and someone saw that I was wearing a sweatshirt, like a 9-line apparel sweatshirt, I think is what I had on. And she was a food truck owner, and she said, "Hey, were you in the military?" And I was like, "Yeah, I was Army. What about you?" And she's like, "Yeah, me too." And the next 20 minutes, it's a whole conversation about what we did in the military. And then obviously I encouraged her to connect to benefits and go see her county veteran service officer. But it's that instant connection that you have with somebody, regardless of anything else. And then just knowing that the culture and behavior is generally ingrained in people to some degree, obviously more for some than others, but it's there and it stays there for life, and it has its own language, values, customs, traditions. like I said, physically and emotionally, military service changes people. Doesn't mean it always is a bad change. I think for the majority of people, they would say it was a positive experience. There are 5 branches, and I keep leaving out Space Force, so I don't have it on there. So there's actually more, but not all veterans are soldiers. So that's a common misconception. Depending on the branch that you served in, you're called something different. Soldiers are Army. So just being mindful of that, and not assuming everyone is a soldier. There is a hierarchical structure with the chain of command. There's an enlisted culture and an officer culture, and those two are very different within military culture. So that's something to be mindful of as well. There are detailed operation manuals or ways in which tasks are performed, and it's standardized for everyone, and everyone does it that way. And so sometimes that carries over into a veteran's life and their expectations for other people. Obviously, veterans may have been exposed to combat or other types of conflict. There are different eras of veterans, different combat missions of veterans, and then just being mindful that military service is often during someone's formative years of life and how that may shape the rest of their life. Thinking about the military value system, always being mission ready, no matter what you're facing, what service looks like, what training looks like. I mean, the value system puts self-sacrifice, pride and strength and toughness. Vulnerability is weak and discouraged. You have battle buddies. There's a camaraderie with those that you serve with that is different than the relationship you have with anyone else in your life. It's work hard, play hard. Many veterans experience multiple deployments and duty stations, often overseas and often away from their families and loved ones. And it's not just one time. You know, there's multiple times that they've been away or deployed. The sense of failure or embarrassment that veterans may have when they're unable to perform as they did when they were in the military, and just knowing things like there's no sick days. So, you know, someone who was in the military may not even may, well, likely won't share the extent of pain that they're experiencing if they're having physical pain or physical conditions or disabilities that they're facing. There's just a lot of things that they probably won't share until they feel like you've earned that information. Timeliness. So in the military, there's a saying that if you're on time, you're late. Pride in appearance, conduct, and physical fitness. Another thing that can be an issue for veterans if they're not able to maintain the level that they had when they were in. Like I mentioned, tattoos. And then just kind of the culture of a warrior culture, pride and physical strength, taking care of your battle buddies. There's really no patience for excuses or those that are perceived as slackers. They don't want to admit when they're having problems and have been rewarded for working through pain or illness. And so by the time they're telling you something's wrong, something's probably been wrong a really long time. And they've been putting it off as long as they can to share it. I think about when I was I was stationed in Germany, and I had gotten walking pneumonia, and we went out on a field training exercise. I think we were out in the field like 5 or 6 days. It was snowing. I have never been more miserable in my life. And my chain of command gave me a challenge coin for for being out there and doing that, regardless of how sick I was. So that's the type of thing that I still carry with me. You know, if you look at how many sick days I have on my calendar compared to others at my job, it's more. So just things to think about. The other thing, and this It's just, I don't know, it's a little anecdote, but just the way military really impacts all facets of your life. So it's not like another job when you're active duty, and you get to go home at the end of the day, and then that's, you don't have to deal with military stuff or your chain of command or whatever. So the military often owns the housing that you live in. Your chain of command can show up at your door anytime, even when you're off work, if you're doing garrison stuff, or on the base. Obviously, if you're deployed, there's not hours that you're on or off. But I remember being told that if the Army had wanted me to have a child, they would have issued one to me. So just things like that to think about when people were in. As far as hazards and exposure, so veterans may have been exposed to a range of chemicals, physical and environmental hazards during their service that most civilians don't experience during their life. Or maybe they do, but on a lesser level or for a shorter amount of time, depending on the hazard. Chemical hazards, when I think about that, I think about Vietnam veterans who had Agent Orange exposure during their Vietnam service and how much that's impacting their life now. There's contaminated water issues like at Camp Lejeune. As far as like Agent Orange exposure, it may cause things like type 2 diabetes, ischemic heart disease, cancers, that type of thing. Radiation, exposure through nuclear weapons, all kinds of things obviously cause cancers, leukemias. Air pollutants, we just saw some changes in VA law as a result of burn pit exposures that those who served in Iraq, Afghanistan, and some of those other areas had while deployed, and the health conditions that are associated with those. There's other occupational hazards that people may have had while they were in the military, lead, asbestos, warfare agents, so chemical and biological weapons, and then just different hazards specific to where they may be deployed, and what that particular country or area looks like, and even things like experimental vaccinations or medications, anthrax vaccine, that type of thing. That was something that we had multiple, a series of anthrax vaccination when I was in. So just different things that are happening all of the time. And not only just these specific types of unique exposures, but just other health challenges and conditions that come through service that are different from civilian counterparts. So for instance, ALS is now a presumptively compensable illness through the VA for all veterans who've had 90 days or more of continuous active service in the military. And that just seems crazy to me. So if you serve 90 days or more active duty and you have ALS, the VA automatically presumes that it's because of your military service. So just serving has caused that. No other identified hazard is key. So something there to think about. And then just once a provider is established that their patient or the consumer is a veteran, just paying particular attention to signs of specific challenges or health issues that they're facing. So exploring what actions the veteran has or has not taken to resolve potential military related health concerns, and then determining if further assistance may be required beyond the scope of your practice, or if there's, additional specialties or things that should happen. One thing to know is the federal VA offers healthcare registry exams or health registry exams for different eras. So if you're concerned about Agent Orange exposure that you had, you can register for an exam and then be part of that registry so that they can continue to track what's happening with veterans who had that exposure, and then look at trends. And then they may also reach out to you at some point and say, hey, there's been this change. You participated in this exam. We identified these things as conditions for you, and now they may be compensable. So just knowing that those types of things exist in your roles, and steering veterans to participate in those types of things really are important. The other thing to think about is just how exposures, obviously, like we mentioned, can result in physical conditions or disabilities, mental health conditions, but also we see increases in houselessness, substance use, and divorce rates or marital difficulties, and in some instances, domestic violence. So additional results of these types of exposures to think about. Hearing loss, tinnitus, hepatitis C, suicide, cancers, like I mentioned, ALS. There's just a lot of things that can continue to or potentially be an issue even down the road for veterans after service. And it can be a long time after service for some of these things to start happening. The Health and Health Behavior Differences U.S. Military Veteran and Civilian Men Study summarized that after adjusting for demographic factors, including age and other things, the study found that veterans were more likely than civilians to smoke, use alcohol, be obese, have cardiovascular disease, and be limited in activities. Same thing here, just knowing that veterans report a higher percentage of serious psychological distress and were more likely to report limitations in their ability to work compared to their non-veteran counterparts. Additionally, veterans were significantly more likely than non-veterans to report experiencing 2 or more chronic health conditions. Another thing that is interesting, I guess, to me is that veterans are more likely to choose to live in rural areas than Americans who didn't serve. So obviously, they're drawn to rural and remote areas for a number of reasons, but often greater privacy, less crowding, there's a lower cost of living generally. And then a lot of times veterans are interested in the outdoors or other type of kind of outdoor recreation. And so that's something to be mindful of. Rural veterans do tend to use VA healthcare systems more. They're aging. They tend to earn less financially. They suffer from multiple medical conditions and military exposures. Just a lot of different challenges that veterans that are rural may face compared to the non-rural veteran. And then obviously they're facing all of the same challenges and struggles that any rural resident are facing, but it can impact what their experience is looking like as far as their physical and mental health. There's fewer hospitals, providers, clinics, geographic and distance barriers to get to those providers and clinics, higher rates of uninsured folks out there, all of that stuff. And sometimes even just the stigma of accessing services in a rural area because everybody kind of knows everybody. They see your car if it's parked at XYZ, whatever the case may be. And so how that shapes health for rural veterans is important because as they age, we're seeing them facing kind of greater health issues because some of these things may not have been addressed because of where they were living. Sadly, veterans are regularly portrayed in films and the media as all having been in combat and as having served in the infantry, all having PTSD, being unstable, impulsive, or having a negative military experience. And that's just not the case. So doesn't mean that there aren't veterans who are suffering. We all know that there are, but there's a lot of veterans who are doing well and thriving. So just knowing that the experience for everyone is completely individual to the individual veteran. Some things that I think are important, and I feel like they are common sense and everybody knows, but they don't, because they still get asked. Not every veteran killed someone, and those who did definitely don't want to talk about it, or don't want to be asked about it. So that's obviously something to think about. Not all veterans have PTSD. The majority of veterans, in fact, do not. Those who do have invisible wounds or PTSD or other mental health conditions are not dangerous or violent. It's extremely hard for veterans to ask for help, especially from others. They generally haven't valued self-care. The expectation is that they're going to complete the mission or continue on no matter what. And so having patience with that is much appreciated. Like I mentioned before, many veterans entered military service during the most formative years of their life. And thinking about the responsibility they had at a very young age is unlike any other job, except for maybe law enforcement or firefighting. But even then, most of the time you have to be 21. Or I guess in Oregon, I don't know about other states. In the military, you're 18 and doing some pretty incredible things, and could be deployed in combat at 18 and having responsibility for other people's lives at 18. I joined the military after I had already gotten my bachelor's degree. So I think about what what it would have been like to join when I was 18, fresh out of high school. And it's incredible. It's incredible the amount of responsibility that someone has at that age. And then getting out of the military and trying to find how you can still have that same worth in a civilian way. It's pretty incredible. So something to think about there. Not all veterans, like I said, served in combat, obviously, and then knowing that not all veterans are going to be entitled to all veteran benefits. So nearly all veterans are entitled to some benefits. It may just be the home loan guarantee or a burial benefit, the ability to be buried at the National Cemetery or whatever the case may be. But like I mentioned, may not be eligible for VA healthcare, may not be able to receive compensation or pension or other things. So just knowing that is important. And as I'm sure you know, if you've worked with veterans, many veterans may be perceived as having a challenging personality. I'm sure my family could testify to this. So knowing that may be the case, having patience to deal with that, and also knowing that there are veterans who, because of their experience and how they left the military, for better or worse, and that challenging personality, may have burned some bridges with people they cared about, or have not been able to maintain relationships with the people that they love because of these experiences. And so a lot of veterans are kind of going it alone on trying to take care of themselves, living by themselves. So that can be an additional challenge. And then being patient with smoking, swearing, and tattoos. It's changing. I know that, when I was in, smoking was the thing. And whether you smoked when you were, when I was in Germany, you did when we got to Iraq. Everybody smoked when we got to Iraq. So just that type of stuff. I think, like I said, it's getting better, but it's still definitely prevalent in enlisted culture. There are a number of resources. I have just kind of gave you a little glimpse here of what the ODVA website there's a ton of things on our website, but part of it is being able to click on different things and look for resources. So you could click on a button like this on our website, and it's going to give you information about these different benefits and services for veterans and their families. So know that that's there. Also, the most important thing, if you don't take away anything else today, if you can just remember that there's a veteran service officer who's trained and accredited in every county in Oregon, as well as some tribal veteran service offices and representatives that can help veterans and their families, and it's free. And they're accredited with the federal VA. So a veteran or their family member can make an appointment if they have questions about whether they're entitled to a benefit, if they want help reviewing disability claims, anything. This is a resource for you to refer people to. Again, the ODVA has a pretty substantial website with a ton of information about resource and benefits, as well as a contact directory for all of the veteran service officers in the counties, the state veteran service officers, and even the tribal representatives and campus veteran service officers. They're all there in that directory. You also can connect with us for news informations. We have information. We have a host of different publications and resources as far as Facebook or social media, where you can get news about things that are happening with the federal VA and state benefits as well. You can subscribe to emails or other things there, super easy. And that's me. If you have questions, concerns, anything, feel free to reach out to me. And then also just past here is kind of the questions just to start the conversation with a veteran about their military experience that I thought might be helpful. And that's a wrap. If there's anything, I didn't really pause, sorry, Holly, but I assumed you'd interrupt me if there was something that came up.
Thank you. Does anyone have any questions? If you want to put them in the chat or unmute yourself, feel free to do so. And I was taking some notes here, so I'm going to share some resources that you shared with folks via email.
Oh, so great, thank you.
Yeah, so everyone that was registered can get that.
Excellent, thanks so much, Holly. Yeah. Awesome. Yes, yeah. The PowerPoint,
yeah, I'll have you send that to me, and then we'll share the PowerPoint.
Thank you all so much. I really appreciate it. Thanks for being here.
Any other questions? Okay, well, thanks for joining us, everyone, and thank you, Lacey, for all the information, and
absolutely,
thanks for being here today.
Yes, likewise. Have a great day.